Hello, and thank you for joining us today. I'm Amy Batson, President of WomenLift Health. And today, as we at WomenLift Health continue our work to advance women leaders in the health sector, we'll be discussing some new data highlighting the barriers facing women leaders and the opportunities to address these barriers, but bringing a country and regional lens to the discussion. We do have French translation on this webinar, so if you prefer to hear the discussions in French, please go to the bottom of the screen and click on the interpretation icon. Women's leadership has the potential to transform the global health sector by bringing fresh perspectives and expertise and new leadership styles and energy to the public health challenges facing us today. However, women face many barriers in their journey to leadership, challenges that ultimately exclude far too many women from decision-making tables. And while the fight for gender equality is global, some of the specific barriers that women face and the specific opportunities for change differ across regions and countries. To better understand the barriers and opportunities, WomenLift Health partnered with 4 local research firms: Bixel, LEAD, Next Year, and ICRW. They each brought to this work not only their technical expertise, but also deep understanding of their own country's landscape. They engaged individuals and organizational leaders in health in their countries to gather perspectives and learnings to answer 3 primary questions. What are the barriers and opportunities to women's leadership in health? What are the current efforts that foster women's leadership and diversity, equity, and inclusion in organizations? And how might we work collectively together to further our shared goals? The resulting reports highlighted some of the interesting cross-cutting challenges, some that are universal and some that are more region-specific. To set the stage for our panel discussion, I'm highlighting here a few of the most common challenges. Limited women mentors and the importance of having mentors and role models, which is why at WomenLift Health, we not only match our women leaders in our leadership programs with senior women mentors, but even more importantly, encourage every woman to become a mentor for others. Gaps in legal protection that allow gender-based discrimination to continue. Mobility and safety concerns and challenges for required travel and work. The Old Boys Network, which is our historically male-dominated health sector, actually results in giving a hand up to other men and keeping women out of leadership. And I'm excited about what I see with the growing circle of women leaders and, for example, our alumni network of women leaders, which I think of as the counterbalance to the Old Boys Network. It's the New Girls Network. Imposter syndrome, and how sexism around all of us can be internalized and can undermine self-confidence. A senior NGO leader in India spoke so clearly to this challenge. She noted, quote, right from the day a girl is born, she's told, don't talk loudly, sit properly, make yourself small, don't act overconfident. She went on that in the social context of India, women are discouraged from owning and sharing their achievements. And the resulting lack of internal confidence is often what creates the biggest barrier. And last, gender stereotypes. Women are the default caregivers in their families, and the implications that responsibility, shouldered by women, has on work and life integration. The report also identified some of the initiatives addressing these barriers and the gaps in those efforts, the continued needs. This report's available on the WomenLift Health website, and my colleagues have included the link in the chat line or Q&A line. This webinar will be recorded and will be available on WomenLift Health's YouTube digital platform. So to discuss the findings, we're joined by 4 key opinion leaders who will share their experiences and perspectives from the countries and regions where they've lived and worked, shedding light on the barriers that women face and thoughts on how best to address them. Following the panel discussion, there will be a Q&A session, so please write your questions into that Q&A segment throughout our conversation today. My colleagues will be collecting your questions and then posing them to me to pass on to the panelists later on. So without further ado, let me briefly introduce our 4 panelists who have kindly allowed me to have abbreviated introductions for their many accomplishments and who have also agreed to our being informal and to me using first names following this introduction. So first, Dr. Yasmin Ali Haq. Yasmin is the chair of WomenLift Health's Global Advisory Board. She's a former UNICEF executive, having served most recently as the UNICEF representative to India. She's a medical doctor trained in Bangladesh, and she brings to the conversation her experiences as a South Asian woman leader with years working in Bangladesh, India, and many other countries. Second, Ms. Obasere George Ogon, who goes by Bose. Bose is the founder of the Women in Leadership Advancement Network, or WELAN, in Nigeria, where she dedicates her time to inspiring a shift to gender-balanced leadership across all levels. She's brought a DEI lens, diversity, equity, and inclusion lens, to her work to improve health, education, and economic outcomes across Nigeria and West Africa. We also have Dr. Rohini Anand. Rohini is the principal of Anand LLC and the author of a really good book, Leading Global Diversity, Equity, and Inclusion. She's the former Senior Vice President of Corporate Responsibility and the former Global Chief Diversity Officer at Sodexo, where she was responsible for the organization's transformative change to put DEI, corporate responsibility, and wellness at the center of its culture. She'll provide valuable insights into fostering cultural and policy change in institutions. And last but certainly not least, Dr. Nora Budo. Nora is the Health Integration and East Africa Director at WomenLift Health. She's a medical doctor and public health specialist and brings to the conversation both her personal understanding and experiences from East Africa, particularly Kenya, as well as those of all the women leaders she's been working with as part of the WomenLift Health leadership journey. Thank you all so much for being with us today and sharing your unique perspectives and experiences. So to start our conversation, I'd like to explore, why are these studies important? Who will use them and how? What might it inform? So Yasmin, if I could start with you and just put it on the table. How is this data useful? As the former UNICEF rep in India and other countries, how might this data have informed your own thinking? Yasmin, you're muted.
Thank you so much, Amy, and greetings to everyone joining us. We have data now, and we're able to start building a narrative. When I started my work in public health and as I progressed into leadership positions, a lot of what I did or focused on was based on instinct, based on my own experience, and there has been a dearth of data. What helps women's leadership? How can you have a more collaborative team? How do you bring more women into the fold? These are questions that we try to answer based on our instinct. And now with the data that is coming up and what we're learning from our brilliant alumni cohort with WomenLift Health is that we have the evidence. We have it documented, what works, what wouldn't work. And it's amazing to see it's not just in particular to a country or a region. Most of these issues are cross-cutting. And it's really about how we localize it and how we encourage mentors, women mentors in different countries to come together. When I first started working in the field of maternal health, I actually had to write a justification for why the organization should focus on maternal health. And we have all the data and evidence that links it because it's a conduit to improving child survival. And now more and more it's a link to education of the children, et cetera, et cetera. But why not for the women's sake? And I think when we're coming to leadership, we now have the data that highlights that in this pyramid, and every leadership has a pyramid, but when 75% of the workforce is women, yet only 25% of the leadership is women. Clearly, something has to be done about it. So it gives us that sense of urgency. And then finally, I'd like to flag that really we have been working on the basis of organizational commitments to gender equity, to diversity and inclusion. But we have the data now, and it shows that unless we are measuring it, unless we are really looking at the data and evidence, we are not going to be holding ourselves to account as to whether we're making a difference or not.
Fantastic, thank you. And I can't believe you had to write a justification for investing in maternal health. Isn't that extraordinary? Bose, so taking a Nigerian lens, how might the report's findings from Nigeria inform, maybe inspire institutional leaders, parliamentarians, and politicians to advance women's leadership in Nigeria and West Africa?
Thank you so much, Amy. So I think, just picking up on, I think, where Yasmin left off around evidence. Now, I'll be very open and honest. Nigeria is not lacking evidence of just how bad things are when it comes to women's leadership. But I saw just going through the report, it was a lot of validation, you know what I mean? Especially for the work that we do and for the nation as a whole. So, but what I see is an opportunity. Nigeria has a new administration that came into office in May this year. And I think there are indications that they're willing to take some positive steps. So that's one opportunity I see. I think the second thing is, Nigeria has had a national gender policy since 2006, but unfortunately it has never been implemented. Now, the opportunity that I see here again is putting the right legislative framework in place. There is a joke amongst the women's movement in Nigeria. We say every 4 years we get enthusiastic again. And so we're telling the 10th Assembly that you will be the ones, that push for all the gender bills that we have been pushing for many years. And I think that, going through this report, it just further validates that, look, if you want to be playing at a certain level on the global stage, then this is actually what we should be doing. So I think even the women's movement will benefit from the fact that this is not just us looking internally, but this is something that affects all of us and could have a huge beneficial impact in terms of the health outcomes for the nation. And Nigeria, as you know, is a huge country when it comes to population. So I think really and truly, it's just further validating that we need women as leaders in the healthcare sector. And as you know, the Minister of Health specifically is someone who's a global leader. Even though he's a man, I can assure you that he's a male ally. So I do see a lot of opportunities for really translating the recommendations that have come out of the report and practicalizing some of those recommendations on the ground.
Very exciting. And that opportunity to be affecting not only leaders of health institutions, but leaders in the government, such as the new Minister of Health, Mohamed Pate, and other politicians. Rohini, in your experience as a change leader and an advisor to institutional leaders, do you find are the leaders typically aware of the barriers that women face in the workplace? And does this contextualization of the information yield, other important insights?
Yeah, thank you, Amy. Delighted to be on this panel, very distinguished panel. So just picking up on what Bose and Yasmin said, I think, Yasmin, you talked about, having to make the justification for maternal health. Even today, organizations are making a justification for gender equity. Ridiculous, right? Mm-hmm. When did we have to justify male equity? Opportunities for men. Anyway. But I think to your question, Amy, I think that leaders actually choose not to be aware. And I think some of it comes from a sense of privilege of not having to think about their identity. And oftentimes it takes some kind of a disruptive experience. And when they're confronted by their bias and their privilege, that's when they start sort of getting it. And I'm a firm believer in story sharing. So just a quick story to illustrate this. One particular leader that I was working with was on the sidelines, was not an ally, questioned the validity of all the work we were doing. And then he wanted to get involved in a cross-company mentoring program because he wanted to network with other CEOs. And this gave him the opportunity to do that. And he mentored a woman from a different company. And she shared with him her experiences of being the only woman on the executive team, of being marginalized, of being talked over. And finally, she was laid off. And he came to me and he said, if this had happened to a woman on my team, I would have said, well, those are the breaks of the game. Men get laid off, women get laid off. But having built this very trusting relationship with her and having listened to her lived experiences, he said, I can't believe this is happening even today. So, your question about, do leaders understand? So I just can't believe this is happening, till he made himself vulnerable and was able to listen. And he said, I don't want this happening on my clock. And when leaders get it, when they have that experience, it has a cascading effect. So he actually had all 12 of his direct reports mentor women from different parts of the organization. And one of those men came to me and said, he mentored a woman who was managing a high security facility. And he said, if you had presented me with two candidates, a male and a female, and asked me to hire the best qualified, I would have hired a male because you need an assertive, aggressive leadership style. But after mentoring her, she has a different leadership style, but she's very effective. I won't let that bias come into play. So I think it takes, men have to kind of get it, and they don't always, but we've got to work on male leaders. And I think that takes, courage, it takes curiosity, it takes commitment. And certainly, I don't want to take up too much time here, but the contextualizing is very important because it sheds different insights. A nationally mandated parental leave policy, for example, can have unintended consequences. For example, a career penalty for women. And I saw that vividly in Germany, where women, can take up to parental leave is up to 36 months. And it's mostly women who take that parental leave. And when they come back, 65% of them take part-time jobs. And those are real career derailers. And if they take 1 year off, it costs them, they come back earning 10% less than other women. Look at that context versus the US context, where there's an absence of federally mandated family leave, which has, other implications for women's careers, obviously. So context really does matter.
Oh, fascinating. So Nora, building on what Rohini's highlighted and how important context is, from the East Africa perspective, what's been important in the contextualized data, and what's a unique challenge or opportunity that really stood out for you from this report?
Thank you, Amy. That's a really good question. And just piggybacking on Rohini's point around contextualization, it's very important to contextualize this data and what it means for the women in these different sections. Because it helps us to, be familiar with our user and the world in which they are actually living in. So I just want to take us just through the context, looking at Africa. Of course, looking at women's health leadership in Africa, we're still lagging behind. The gap index or the gender gap index of 2022 showed that we're still looking at perhaps 130 years to close this gap. But what's exciting, of course, looking at the East African countries, Kenya, Uganda, and Rwanda specifically, there's been a lot of, we could say political will around, having all this in the constitutions and the national policies. And this is where we find some differences, of course, between the different countries, where you'll find that in Rwanda, more than 60% of, the political leadership are women. But then again, when you look into the health sector, there's a disparity there because there are only maybe 33% in the public health sector that are women. Similarly to Kenya, where, politically, there are great moves towards having women in political leadership. But again, when you look at the health sector, only 40% are women. And again, looking into Uganda, that is scoring only 26% of public health in public health sector that women are represented. So we look at these unique issues between the countries. There are common issues that have come out in the report, where we are seeing that the culture of patriarchy and male dominance is a common thread, and women are consistently being seen as meek, incapable of objectivity, and strong leadership as defined with all its masculinity. But then the women have also talked about the motherhood penalty. Whether you are a mother or you have no child, you still will experience motherhood penalty. You will not get a job because you're pregnant, or you anticipated that at some point you will get pregnant and you will require leave. These things are still running across. And I would like to just call out as well, just on the unique things that were being brought up by each country. Like, for instance, in Kenya, nepotism and was an issue around tribalism and marginalization of minority women into leadership. That was something so unique to Kenya in terms of what came out in the report. In Uganda, they spoke of difficulty creating a support network for women. And I think this was mentioned by one of my panelists, where we're seeing women lack that network, mentors, sponsors, nominators, referees. That is something that was really coming out strongly in Uganda. When we look at Rwanda, they're doing very well in looking at gender equity. They also have a gender monitoring unit, which is something that is exceptional for Rwanda. But again, they also see that women are being put in positions to fill a quota, but not necessarily being given the support they require in leadership. So this was something, again, very unique to Rwanda. But we have opportunities to support these women at individual, again, institutional, societal levels. We need to look at how we can collaborate with these partners, our partners, to support development of a robust strategy to support women's leadership. We also need to look at the research. We do not have enough gendered research on women's leadership in the region. And as well, to continue to build a momentum through sector-wide advocacy for women's leadership and target social norms. So for me, these are the opportunities that exist. The momentum is there, the conversation is on. We just need to build on it and move forward. Thank you.
Fantastic. So, I think we've heard there's an old saying, right? You can't improve what you don't measure. And I think Rohini's added to that you can't understand what you don't even see. And all too often these barriers are invisible, or they're accepted as normal because they've frankly been normalized within an institution or a country. So I want to continue to dig into some of the findings. And Bose, come back to you. You've highlighted the every 4 years women get excited. But as a Nigerian women leader, what are some of the key insights that resonated with you? And as you look at this new administration, that you think there's some particular opportunity around?
So I think there are a few things, and I will start again from the legal framework, because I think the evidence really shows us that if you want to increase women's leadership across board, gender quotas do work, right? I know that there are reservations about gender quotas, but they do work, and the evidence is there. So I think that there is an opportunity to think about the healthcare system and actually work with stakeholders, both in private sector and in public sector, to think about how do we support women, how do we create intentional programs to actually advance women's leadership. And so I think one of the things that comes out very clearly from the Nigerian context is this burden of care that usually lands on women, and that is underlined really by the stereotypes and the norms, where we believe that women make great nurturers, right, and carers, but not leaders. And I think that also is mirrored within the healthcare system, where it's okay for women to be nurses or within public health, but not, mainstream or leadership of the healthcare system. So I think the first thing would be to think around what legal frameworks can we put in place, right, that almost forces normative change or behavior change, because we just can't afford to wait for people to change their behaviors. So that's one thing. I think there's also a huge opportunity with equipping young women. And I saw that that was one of the things that came out within the Nigerian context. And you cannot blame us, because we're a population that has 60% below 25. right? So there's this huge opportunity. And I think with the young women, they actually have less burden in terms of the norms because they're growing up in this digital age, they're digital natives, and the world is changing. They're living in a global world versus some of us. I'm a millennial. There's some of us who kind of exist in that world where some of those traditions were passed on to us. And then we're watching sort of the generation after us not carry as much of that burden. So I think equipping young women is a huge opportunity just because the population there is great. And also, as somebody who has worked with women leaders, this point you made about imposter syndrome is huge, and there's internalized bias. And so while we work on, programs like the ones that WomenLift Health does to work with them to sort of, unpack some of those, I think there's a lot that we can be doing with the younger women themselves. And then I think the final point I'll make before I pass it on is advocacy. And the reason why advocacy is important constantly is because regardless of what you're doing, at the individual level, at the organizational level, if the perception of women as leaders does not change, then not much will change.
Great. So we call that reimagining leadership and what good leadership looks, sounds, and acts like, and getting that out on the platforms. Yasmin and Nora, I'm going to give you both the same question. Would ask you to kind of briefly respond to it from your own vantage. But reflecting on your experiences, what lessons can be learned from understanding the barriers to women's leadership? And how can these lessons inform action to start empowering more women to lead? So Yasmin, from your perspective of India, South Asia, sorry.
Thanks, Amy. And, as Bose said, you do need that legal framework. We need the institutional framework to be put in place that helps us address it without having to justify it, if I can put it that way. What I'd like to share is my experience in taking it forward over, addressing this over the past 20, 25 years, and what have I learned and how have I adapted to it to be more successful, if I can put it that way. One is to understand that whenever we have legislation and policies in place, people do put on masks and layers. It's like peeling an onion skin. So because it's politically correct to pay attention to gender diversity and inclusion, people will say certain things. And what we have to learn as leaders is really to peel away what people say and what they mean and what they're doing. So it's the action that we really need to dig down to. And in that, we have to support those who are risk takers, whether they're men or women, who are trying to build a platform which younger professionals, mid-level professionals, even senior professionals can use to advance their career, to advance their leadership opportunities. We have to support such people because they can fall into various traps. It's also about recognizing that even women's leadership, and I go back to what Bose said about the typical nurturing leadership, but women have different styles, and every generation, I think, has a different style and a different way and a different approach to it. And we do have to respect the different styles. At the end of the day, are we being professional? Are we being consistent in application of the policies and norms, whether it applies to men or women? And are we really supporting those who are genuinely trying to make a difference? One thing that I always try to do is create space for women in an organization. I've been in an organization, fortunately, where there has been a lot of push to have equity in numbers by level of professional categories. And there it's been important even for the women to come together. So being unapologetic about having a women's network meeting, bringing women together for a social evening, opportunity to let your hair down, It's countering, it's a bit like your New Girls Network, where women can come together. And again, it's learning from creating a space where women are comfortable to raise their concerns, to talk about it, to share solutions, and to give each other that confidence and courage. And finally, what I'd say is, from my own experience, any opportunity I've had that has supported me in becoming a woman and a leader. So it's not to deny our characteristics as an individual, as a woman, but to build on that and to become a leader. And I think there are opportunities in all the areas that we've seen come up in the report for us to be mindful of keeping certain basic principles true. So I'll stop there, Amy.
Thank you. Nora, can I ask you, maybe just take one experience from the women leaders in the East Africa leadership journey to kind of illustrate how this is playing out, how you've seen this playing out with some of the women in the leadership journey, through the leadership journey in their own institutions.
Yeah, thank you, Amy. And I think the experience has been it's been amazing to see what the women are, picking out from the leadership journey experience, which is supported by mentors and coaches. They have appreciated networking, number one, is which Yasmin was referring to. Networking, which is an opportunity for them to meet together, let their head down, discuss work, discuss home, discuss life. Very critical, because women do not have these opportunities to do that. And we're able to see that in one of the platforms where we created for women to network. And we had a donor sitting from US, sitting with a Kenyan cohort member, or who was now an alumni, discussing a project. And in that way, they were able to bring together the conversation around funding and a specific initiative that a woman wants to run, which would not have been possible without that platform for them to discuss and engage. The second thing, of course, is around coaching. Coaching has not been something that is available, particularly in Africa and East Africa. So this is something that they've really called on, has supported them in their leadership in terms of negotiating for their salaries, number one. That has been something that they're not able to speak to, even as we talk about implementing equal pay policies. We have to be able to agitate, to negotiate, and, speak to and, claim what is actually ours, because we deserve it. Another thing that I wanted to call out on was the issue around male allyship. For instance, we did have a male ally workshop, and we brought in men who the women had referred to us. And we had a conversation around what do they think about male allyship? How do they support women in these spaces? The women who don't have voices, even in a board meeting where there's only one woman and 10 men. How does it work? Because you can only work with men who are part of the ecosystem. We have to be able to identify men who will support us and speak out on our behalf, as well as we try and look at leadership parity. And we could see the women in the workshop really feeling affirmed as well, because the men were coming to the point and saying, hey, women, how do you do this? You people are amazing multitaskers. You manage home and you manage work and you still deliver. And, for the women to hear that even the men are admiring them in that way was something. They don't need that validation, but it was just that affirmation that, they are being recognized in how they're able to work. Men were also giving examples of how they're supporting the women in their organizations, that if they've given a point, they will acknowledge and even call it out in the meeting room and say that this was Jane's comment. Please acknowledge that this came from her. Do not turn it around to look like she did not speak or she did not give a point. And so this aspect of male allyship is very critical, because we are not working in isolation as women. We are working in an ecosystem, and men are still up there. They're still in leadership. We should be able to identify those who will be supportive of women's leadership. We should be able to create a network, and we should be able to have their voices coming out in support of women's leadership. So those are the things that I'd want to just bring out at this point. Thank you, Amy.
Fantastic. Thank you. So Rohini, how do the report findings align with the challenges and opportunities that you personally encountered in both leading at Sodexo and advising other companies on action to close the diversity gap?
Yeah, I think, Nora has kind of summarized a lot of the challenges. And I think the challenges, that ones that are common, really do exist in many parts of the world. I think the one around stereotypes and biases that are prevalent are very potent. This whole notion that women are, suited for certain jobs, they're not necessarily leadership material. How performance reviews are written. I've seen this time and time again. For men, it would be action-oriented things, results-oriented words. For women, it is more collaborative, team player, nurturer. And leadership is typically synonymous with those results-oriented things. So I think we've got to really be mindful of that. I think the other piece there is that I have seen that men are promoted based on potential. Women are promoted based on performance. So women have to perform again and again and again. Men are assumed to be capable and promoted on potential. I've seen this in succession planning discussions or talent reviews where there'll be a conversation about a global assignment that's really important for the next position for someone in their career. And immediately you'll hear comments like, oh, she has little children, she's not going to be interested. Well, let her decide whether she's interested or not. She's capable of taking ownership of her own life. So I think that's where the solution that Nora talked about and others have talked about in terms of redefining leadership, making sure that leadership is not based on a Western male model. And then I think ensuring that we're cultivating allies at all levels, women allies to other women and men allies to women as well. I think the other piece is sort of these systemic barriers there, that the report also identified: the lack of role models, the lack of mentors, the lack of access to networks, bias in the system. Recently we think that AI is going to solve everything, all of our problems. Recently, Amazon actually got rid of their AI in recruiting because what they found was AI was sort of picking only male resumes and not female resumes. And the reason was it was sort of based on historical data. And for this particular line of business, they had hired mostly men. So any resume with the word woman in it was being discarded. So at the end, they had another pile of male resumes. So I think, examining every point of our sort of talent process to eliminate systemic barriers is absolutely critical. And I will just add one piece, Amy, which is in the United States, women of color are at the short end of all of these biases. For every 100 male that are promoted, 87 female are promoted and 82 women of color. We have 25% white women in the C-suite, 5% women of color. So clearly, we've got to really look at intersectional identities because women don't present as a sort of, uniform group. We all have intersecting identities. I think several have talked about the imposter syndrome, and Yasmin, you talked about taking risks and, this internalized sexism. And Nora, I think you talked about sort of salary negotiation. A Harvard study actually looked at women and men with the same degrees getting their MBA degrees, and women start at a deficit right there in terms of salaries because of negotiation, and that they never catch up. So many organizations have actually said now that they don't want to ask, recruiters cannot ask for previous salaries. You sort of give people a range and you can't ask what you were making before. But I will say that, part of the imposter syndrome that I question in different parts of the world, particularly in the United States, there's plenty of research that suggests particularly women of color are very, very ambitious. So they're ambitious, so there's clearly a disconnect because they want that next step. But, the systems and biases are preventing it. And the result is that women are disheartened. They're leaving the workplace. And, we almost say this as a badge of honor that women are starting small businesses, but I don't think it's something that organizations need to be proud of, because women are doing that because they're not seeing their careers advance. They're not feeling a sense of uniqueness and feeling a sense of belonging in the workplace. And in fact, layoffs are adversely impacting in the United States and impacting women, because you have 39% of women in tech fields, but 46% of those that are being let go are women. So here this is revolving door. So I think, we'll talk a little bit more about what organizations can do intentionally, but let me stop it.
Yeah, fantastic. Okay, I'm going to sort of skip a little bit because I want to make sure we do have time for questions. And I'm also going to be incorporating some of the questions we're getting into the next round of questions. And maybe kicking it off with Bose and Yasmin. Again, a same question, but from your different perspectives and experiences. So social norms and traditions are obviously key contributors to institutional culture. And as we work to level the playing field for women in the workplace, how do we tap into the best parts of our respective cultures while recognizing it's sometimes these very cultural norms that create or justify the barriers to women's leadership? So, Bose, your perspective as a Nigerian women leader.
No, thanks, Amy. That is spot on, by the way. And I think that, again, therein lies opportunities. And for Nigeria, I think two key things. I think it's part of our culture to celebrate. So we like to associate with success. And I think therein lies a lot of things we've heard today around male allyship. And then, of course, so how do we identify, how do we showcase male allies, right? Because, I think it was Rohini's point about if you don't see it, you don't know it. So I think because I actually know male allies who have been very intentional, who have large corporations and have been very intentional about putting women in leadership. I mean, there's something there as well where people say it might be tokenism, but the truth is those women then present an opportunity as role models where younger women know it is possible, right? And role modeling is one of those things that work. So I think there's a huge opportunity in celebrating, right, success in terms of this is an evidence of it is possible, especially with the male allies, because then other men know that men can champion this cause as well. I think the second opportunity is with popular culture. And I think closely linked to that will be digital media. So in Nigeria, our music, our art, our movies are huge things that impact on, when we talk about our childhood, I feel like we refer a lot to either what we watched, what we sang, what we did. And I feel like in the new age, that has been translated into the medium, which is digital media. So for example, in Nigeria, one of the things that's hugely popular is like comedy skits, right? And just imagine using that to start to shape how people perceive women, where it's not a joke, right? To, make comments or express microaggressions to women. Do you know what I mean? But actually, you start to use those same mediums to correct that behavior. So I think these are the opportunities that definitely exist within culture that we can then translate based on sort of the things that we saw in the report, but start to use it to shape how people perceive women as leaders.
Great. And just a reminder, please be putting in your questions in that question segment. We'll be coming to that in just a moment. Yasmin, same question. How do we address these kind of cultural norms and take the best out of our cultures?
So I'm going to speak from the Bengali culture perspective. Bengalis are very well known for this spirit of rebellion. And I think that's one part of our culture that I would definitely take forward, support rebellion for a social cause, for a social justice cause. And I think what the information, the study brings is the data. And if I go and present this to a policymaker, to someone in authority that, we do have to address because the data is so clear. There will be much less argument to it, if I can put it that way. So to appeal to the sense of rebellion, but doing it in a respectful manner. And I think it's about, in all cultures, I've worked also in Ghana, in South Sudan, in Sri Lanka, and it's very much about women finding different ways of influencing. So really women's subculture is also different. And women, especially in the villages, we've learned so much from our sisters in the villages about how they negotiate space, how they create their space and they get on. And to learn from that. So I think there's a lot that we need to not discard, but really learn from our women. Also the courtyard culture, women coming together in the courtyard, whether it's to talk about it, to sit and stitch together, or to help a young woman who's going to be having a baby. We need to unapologetically bring women together. And not to have to worry about what the men might think. The men will get together in their own ways, and they might enjoy coming together with us, and that's fine too. But as women, we need that separate space. I would say broadening the tent in the sense of in the culture I come from, a lot of kudos or premium is given to the views of elders, and I think that's where the whole mentorship comes in. That as senior women being mentors to the younger, whether they're men or women, because I have had younger men in the organization also asking me how, as a young man, I'm feeling out of place, because when I try to do something either in my family or at work that is woman friendly, I do get teased. How do I navigate that? And it's really important that we are available, both men and women, for our junior colleagues to help them navigate the space. And I think at the core of it, it goes back to that mentoring and role modeling. Role modeling in any culture is seen as important. For us, it's to define what role we want to model, and that role being strong and supporting the development of women leaders.
So the importance of popular culture and using that, because it is powerful. The importance of pulling on things like, we're proud of our rebellious spirit that we've had for popular and social causes. And then really the importance of this women coming together. And we've seen that in WomenLift Health, the power of these cohorts where you have a safe space with other women sharing your experiences and having your back, and mentorship not only for women, but for men as well, and what it means to be a good male ally. Rohini, last question before we move into the Q&A. How can organizational leaders become more intentional, right, about creating the kind of diverse, equitable, and inclusive work environments that's more than just, I think, someone referred to maybe Ebose about the politically correct, right? There's the check the box. How do we go beyond the sort of politically correct statements and check the boxes into the more, kind of action oriented, especially when we see sort of like in the US right now, some of the systemic pushback that we're getting against DEI?
Yeah, so I think intentional is the key word here. I think that leaders have to really be intentional about what they're doing, focus on this. There's always other competing priorities. There's other things to kind of take away the focus from gender equity in the workplace, from diversity, equity, and inclusion. And I think that, change, you really have to treat this as sort of a systemic culture change effort. It's not a one and done. It's not a check the box. It's not just a few actions here and there. It's about changing the ethos of the organization. It's about really embedding diversity, equity, and inclusion in the internal and the external ecosystems. And it's about both, change really happens at the intersection of people and processes, I say very often. So it's about the people piece, which is mindsets and behaviors, and ensuring that you have allies, both women allies to each other and male allies. And it's also about systems change. So ensuring that you really have those checkpoints in your systems. And I think you were referring to the pushback, particularly in the United States, Amy, and the recent decision by the Supreme Court about affirmative action in higher education is one good example of that. That is, organizations are concerned about the trickle-down effect in organizations, and Bose was talking about quotas. Yes, they work, but it's anathema in the United States. So how do you get around it? And I think you can still, tracking data is very important. because you're tracking data to see where the barriers are, what the adverse impact is, and then you put in place initiatives to address them. So this, culture change is about equal access, not equal outcomes. And to do that, you have to focus both on the numbers, or what I call the lag indicators, because that's what you're looking as outcomes, but also on the lead indicators, which is the actions and the behaviors that leaders need to demonstrate to get to those outcomes. So it's about inclusive leadership. So I think, addressing bias in the system, institutional change, looking at it as a systems change effort, but also in changing mindsets and behaviors and impacting inclusive leadership and holding people accountable. I think that's absolutely critical.
Yeah, it's always struck me, or come back often, Rohini, to something you said on one of our board meetings, which is, institutional change happens at that intersection, right, of people and systems and processes. You have to have both. Just the systems and processes check boxes without the informal accountability, without the sponsorship, without the commitment of leaders, doesn't result in true change. And I think there's a lot there. So fantastic conversation. I want to also acknowledge throughout this, we've been getting wonderful comments and feedback and questions from our audience. And so thank you to the audience for this. And, this is an audience that's coming in from all over the world. So it's really fantastic to see the sort of passionate engagement on this subject from around the world. I want to now quickly just go to one or two questions. I see we have 9 minutes left. And so sticking to time, a question that we have from Mona on why, while encouraging men to become allies, how do we encourage men to become allies? Basically, what is it? What do we need to do to help men or support men to become better allies? If I can ask, Nora, can you give us a short snap from maybe the experience with the workshop with men on that? And then maybe ask Rohini, one quick thing that you've seen on how do we actually get men to take this up? I mean, you've given us some good examples already, but one more.
Thank you, Amy. And I think the question here is always the case. Why do we need to invest in women's leadership, and what difference does it make? And we always have to come in with the evidence first, or rather the definitions as to why women's leadership is important. We are very understanding of the different leadership style, collaboration, inclusive leadership that they bring on board, and why it's important even in terms of decision making, and why women should be at the table. And so I think starting from that point, even for the women that we have in the cohort, they identified men who have journeyed with them, those who have sponsored them, spoken about them in spaces where they're not, or supported them through leadership. They're already those that you can actually see in terms of how they speak, how they act around women's leadership, and that is how you start identifying them. But they also need a lot of support because they face negative feedback. For instance, some of them were saying that, if you're supporting women, you're considered a womanizer or you're soft. And I think that is why we need to identify these men and develop a network. They also need a networking movement as they support women's leadership. So those are the two that I can just bring on board at this point. Thank you, Amy.
Rohini, any
I would just add to that very often it's men speaking to other men. So when you have their peers talking to them about, a peer who has actually demonstrated allyship, talking about what it's done to him personally, what it's done for the organization, is very, very effective. And I would say, give them those experiences that help to disrupt their worldview and see things differently, whether it is listening to the lived experiences of women in their organization, of being the experience of being a minority or the only man. If you can give them those experiences, I think, in addition to what Nora said about, the data and the evidence is critical, but then I think you need to go to the heart for them to really get it.
Yeah. So going to the heart, it's making this something personal and internalized to really drive change in behavior. Another question we have from Melissa: how can we make careers in global or public health more attractive to women, particularly young women? Yasmin, do you want to address that?
Yes, and I think it's so important that we keep a focus on that. You would think that in 2020, 21, there would be enough women doctors in India who would be eligible to apply for and take on health specialist posts in a UN organization. But then when I get shortlists that had no women names in them, none of the women had been interviewed, you have to question it. So it's really about keeping an eye on who is applying, how is it being advertised, why are women not applying, and to not recruit. We might lose time, but we have to be intentional in it. We have to be intentional in bringing more women on board. And I think it's really about popularizing the opportunities that women might have in the organization. So it means that we do need to have those policies, and we do need to have leadership that supports women who come into an organization, especially younger women, so that they are able to juggle all the different roles that they play, because we will have to juggle. And it's how the institution and the peers support them in doing so.
Fantastic. So I'm going to give the last word to all of our panelists, but I'm going to start to wrap us up now and then give them the final word. But what a fantastic conversation, highlighting the universal challenges, but the nuance of how this plays out inside of different types of organizations, government versus private sector, as well as in countries, and where the solution space sits within cultures, within what people know and frankly love of their own cultures. And we've really highlighted the importance of the data, that it puts a spotlight and it helps validate what's actually happening in the world, and this whole you can't change what you can't measure. And we've gone even further into the importance of male allyship, and in particular how important it is to make this to make diversity, equity, inclusion sort of a personal experience for men, so they go beyond their sort of privileged view of the world into what it feels like to be a woman, particularly a woman of color, and all of the sort of discriminatory barriers that these women face. I sometimes refer to it as death by 1,000 cuts. It's never one that kills you. It's all of them collectively that has this impact. The importance of institutional leaders taking on change and driving both structural change, policy change, but importantly, the sign of sponsorship and accountability that they can bring. And how important it is for women to have the networks, to be able to come together, to have mentors, to have coaches, and to have each other, right? And the shared experience that that brings. Bose highlighted also the importance of young girls. They are the pipeline. They're looking for the role models. And frankly, I would add in young boys as we look to our future male allies, but how we're helping to be bringing girls to expect to be leaders, bringing boys to expect to be not only leaders, but male allies in their leadership. So I think this has been incredibly useful. We'll be taking, certainly at WomenLift Health, these recommendations on board and incorporating them more into our own contextualized strategies in every countries. But now, the last word to you all, our auspicious panel here. Quick lightning round. One thing that you would encourage those participating in this webinar to do to help advance women leaders, recognizing we have people from all walks of life, all countries, all levels on this webinar. So I'm just going to very quickly go down one thing. So starting with you, Bose, one thing.
So the one thing I'd say is go and look at the data. I feel like a lot of people don't look at the data. Like, just pay attention, look at it. Like, what is happening, right? And I think you'd be surprised. And I'll give you a reason why. In the Nigerian Senate today, out of 109 seats, we have 3 women, and the men are embarrassed for it. So pay attention to the data. Excellent. Data is powerful. Nora.
Advocacy. We must use our voices and platforms to advocate for equal access to education, career opportunities, and pay, as well as inclusive and equitable workplaces. So yeah.
Use your voice.
Yeah.
Rohini.
be allies to each other. We've all come on the shoulders of others, lift other women up. We're all change agents. There's a lot you can do regardless of where you are in your organization.
Fantastic. Yasmin.
And in everything that we do, we keep our eye on the ethos, the pathos, and the logos. So it's head, heart, and mind.
Head, heart, and mind. Thank you all so much for joining, and thank you to the audience for staying with us throughout this and sharing all your own comments, questions, feedback. This has been really a fantastic session, and we have been recording it, and we will be putting it on the WomenLift Health YouTube platform, so that you can pull it up or share it with friends that weren't able to join us today. Thank you to our speakers, and thank you to our audience.